Hi, I'm Catherine, and my topic was muscular dystrophy. And many people might assume that muscular dystrophy is just maybe someone who has lost muscle or not as strong, but it actually is so much more than that and really can affect the quality of someone's life with the disease. So, muscular dystrophy is defined as a group of inherited disorders characterized by progressive muscle weakness. So, there are 9 types of muscular dystrophy, and all of them are categorized by the gradual onset of the gradual loss of muscle. But what makes each one of these forms of muscular dystrophy different is the age that the disease occurs, the severity of the disease, and what muscle is affected by this disease. So Duchenne muscular dystrophy is the most prevalent disease in adolescents, and it's got an incidence rate of about 1 in 3,500 males who are born with it. So it is manifested by rapidly progressive proximal muscle wasting starting around age 3, so very young, and it includes respiratory and cardiac failure or dysfunction that can lead to death by mid-20s. The first form I'm going to talk about is Becker muscular dystrophy, and it is a less severe form of muscular dystrophy affecting approximately 1 in every 30,000 males born with it. It is characterized as having a delayed onset compared to Duchenne muscular dystrophy, as well as having an advanced survival age. So this form in this form, the protein dystrophin only partially functions. So in muscular dystrophin, there's a mutation in that gene. But with Becker disease, the protein dystrophin works. It just partially works, which makes it less severe. So there are many symptoms very similar to this disease that go with, or that they're the same for muscular dystrophy. They just are slower. So, for example, someone who has lost the ability to ambulate, they lose that at a slower rate. So where some people will lose their ability to walk at the age 10 or 12, these individuals with Becker muscular dystrophy might not lose it till 80. So it's very, very slow compared to muscular dystrophy. So the next one I'm going to talk about is oculopharyngeal muscular dystrophy, OPMD, and it is a rare genetic myopathic disease characterized by drooping of the eyelid and difficulty with swallowing. So I read about a study who they compared 12 healthy individuals of the same age as 12 individuals with OPMD, and they found that the individuals with OPMD had a decline in maximum tongue pressure, as well as less than half the maximal tongue strength. So this will affect their language and eating and things like that. So the cause of Duchenne muscular dystrophy is due solely to a mutation in the dystrophin gene, which is what produces weakening of the muscles. So this gene is located on the X chromosome and is identified as the largest gene in the human body. So due to this lack of functional dystrophin molecules, it's either due to a nonsense mutation, so it prematurely stops the codons, or the deletion or duplication that disturb the reading frame of the dystrophin gene, which abolishes the production of dystrophin, which makes the muscles weaken. So some might not have it at all, or some might have it too many of this gene, and the mutation is what causes the weakening of the muscles. So there are a wide range of signs and symptoms in this disease. So all of these signs and symptoms, they can include physical behavior, psychological, cognitive, or even speech and language variations or delays. So also, they found in one of the studies that I read that cognitive impairment is present in approximately 1/3 of the patients in the study, and they have a lower IQ score than children who are developing healthy in a healthy way. So these patients with Duchenne muscular dystrophy have a lower IQ as well. Um, Another symptom is language delay, and language impairments seem to increase when the child starts school. So very, very young age. Another symptom is musculoskeletal pain, which can create problems with bed mobility, gait, and even balance. So someone just walking up the stairs or just standing up or this is very limited for them and a big challenge. This neurodevelopmental delay is likely to be the expression of the involvement of the brain dystrophin isoforms rather than weakness that would decrease over time. So what that means is the role that dystrophin plays on in these patients affects the muscles and weakening way more than just the natural aging process. Hip weakness is very typical, which leads to awkward gait patterns as well as an increased chance of falling. So it does make it challenging for them to do everyday activities. So gait begins to deteriorate around the age of 3 to 6 and is potentially lost completely by the age of 10 to 12. So these patients with this disease, Duchenne muscular dystrophy, they're potentially in a wheelchair by the age of 10. So, like I said, gait has a big thing to do with it, which obviously it does with the weakening of the muscles, and this also cause muscle and tendon retractions and joint deformities. Another complication or common symptom of this disease is sleeping, and it could be due to the medication that the patient is on or a positioning device that the patient wears to sleep because they are not able to move at all. And so they have them in different devices, and all that can contribute to how the patient sleeps. So oropharyngeal weakness is also a sign or symptom that goes along with it, and so they have to have an increased mastication effort as well as difficulty swallowing and a decrease in pharyngeal movement. So this definitely affects how they eat and talk and everything, and so it is recommended that a softer diet or less the less thick the fluid intake is, the better. And so as a clinician, it is important for them to know that these patients should not be having like milkshakes and things like that, because it can make it worse. So another sign or symptom that can actually make the disease worse is obesity. It can make it worse by exerting extra force on the already weakened muscle groups, which broadly decreases mobility even more. So muscular dystrophy is due to the mutation in the gene dystrophin. This gene is essential for the stability of the muscle because it provides the link between the muscle membrane and the actin cytoskeleton, which is what is crucial for cell division. So when there is no link between the muscle and the actin cytoskeleton, this is not able to reproduce any cells, and therefore they're lost, and that goes to weaken the muscle and deteriorate the muscle as well. So when there's a depletion or a duplication in the fibers, the intracellular calcium regulation in the body is compromised as well. So the calcium deregulation in the body is kind of what triggers a chronic inflammation or can create these cycles which regress the muscle, it progressively regresses the fibrotic material. So it pretty much, instead of allowing it to do what it's supposed to and be normal, what it does is it degenerates it, makes it weaker and weaker. So this disease is potentially fatal, and they have not found a cure. There's not an effective treatment except for palliative therapy. And so what this does is they are using different things to help slow the onset of the disease or decrease the symptoms so that it is not as severe. And so the goal of therapy is for them to try to find the mutation in each individual that will show them what gene and what the mutation is, which will allow them to focus on what they need to do to reverse the signs and symptoms. So the best treatment that they have found recently was just to correct the genetic defect, which hopefully can restore the functional expression of dystrophin, slow down the progression, and hopefully improve the quality of life. They also can use pharmacological treatment as well, so they can use corticosteroids to kind of help decrease the inflammation, which hopefully will help with pain and decrease signs and symptoms as well. And so right now they are just focusing on therapy to lessen the symptoms and slow the disease down. So physical therapy can play a role in the palliative therapy for Duchenne muscular dystrophy by adding different strengthening activities. So for example, if you had a child come in, you could do exercises like crawling on the floor, rolling around, and just any kind of movement is beneficial for these patients. Try to help them gain any strength that they can. And so as a clinician or therapist working with them, it's important for you to know kind of also their diet and letting them know that the softer the foods, the better, and things like that, just to kind of help decrease their pain. So like I said, they have not found a cure for the disease, and it is extremely progressive and has a very poor prognosis. So the weakness in the muscle can generally lead to complete loss of ambulation by the time they are 10 to 12, and also create cardiac and respiratory problems. So respiratory failure is actually the cause of death in up to 90% of patients with Duchenne muscular dystrophy. So even though muscle weakening is the majority of the disease, or what most people know the disease to be, the cause of death is actually problems with the respiratory system or cardiac system. So just taking measures to know what can help slow down the disease or the progression of the rate of the degeneration is crucial for these patients. So in conclusion, the mortality rate for these individuals is progressing extremely fast. So it's just important for clinicians and researchers to find the mutation, so finding what the mutation is in that gene, and then from there working to do gene therapy to help decrease the symptoms and hopefully one day find a cure and give these patients with this disease the best quality of life.